Hello, everyone. Good morning. I'm Elise Memo, Director of Operations at Public Consulting Group and the California Path Collaborative Planning and Implementation, or CPI, Workstream Lead. Thank you, everyone, for joining us today for the California Path CPI Best Practices webinar titled Strengthening Connections with Children and Youth Providers. I will turn it over to Lisa Bistrup from the DHCS team to get us started.
Good morning, everyone. Welcome. My name is Lisa Bistrup. I am the Unit Chief of the PATH team within the DHCS. And we're excited to see all of you here today, looking to learn strategies that support your engagement with CalAIM and the goal of improving the quality of life and health outcomes for our population. I'm joined today by my DHCS colleagues, Michael Weezar. He's the Chief of the Managed Care Program Oversight Branch, and Jillian Clayton. She is the Chief of our Project Coordination Section. Joining from our third-party administrator, Public Consulting Group, is Elise Memo, the CPI Workstream Lead, and Sean Hanwell, the CPI Communication Lead and Collaboration Assistant. We are excited today to have our speakers from HC2 Strategies and Intrepid Ascent, two of our CPI facilitators, and representatives from the First Five Center for Children's Policy and Bay Area Community Resources, who will be presenting our webinar today. Once again, thank you everyone for joining, and I'm looking forward to learning along with you. I'm going to go ahead and pass back over to Elise.
Thank you, Lisa, and the DHCS team. Our agenda today includes first an introduction to our CPI Best Practices webinar series. Then we will head into our children and youth strategies presentations, which include the ABCs of First Five's role in CalAIM's Success Reentry Care Plan, followed by activating public schools as community-based CalAIM referrers for children, youth, and families. We'll have a few minutes for audience Q&A, and then we will close out with some remarks and an evaluation poll. During today's webinar, we will drop all available links to resources discussed in the presentation into the chat, and they can be found in the resources section here on Zoom. The slides and a recording of today's event, along with a Q&A companion, will be posted on the CPI website several weeks following the webinar. As you listen to today's presentations, you can use the Q&A feature to submit questions to our presenters or CPI team. We will type in responses to some questions and address other relevant and common questions in the Q&A document posted after the event. Next slide. In these twice yearly CPI Best Practices webinars, we aim to showcase effective strategies for implementing ECM and community supports, strengthen provider participation in CalAIM, and foster collaboration across organizations to deliver high-quality services for Medi-Cal members. Today's session marks the 6th webinar in our series. Recordings of previous webinars are available on ca-path.com. As well as with all our sessions, today's webinar highlights best practices identified through the CPI initiative. By the end of today's webinar, participants will be able to describe how First Fives across California are partnering with ECM and community supports providers to advance care coordination, and identify strategies for schools and school districts to serve as key system of care partners, supporting effective linkages and handoffs to CBO providers, youth-serving organizations, and MCPs. I'm now going to turn it over to my colleague, Sean Hanwell, who will share more about CA Path and the CPI initiative.
Thank you, Elise, and good morning, everyone. As noted, I will be providing an introduction to PATH and CPI. Next slide, please. For those who may not be familiar, PATH stands for Providing Access and Transforming Health, and is a 5-year initiative that is designed to support CBOs, hospitals, county agencies, and other key partners in successfully engaging with Medi-Cal members under CalAIM. PATH plays a critical role in supporting the statewide rollout of enhanced care management, community supports, and services for justice-involved individuals. And these services are aimed at equipping providers and local partners to deliver person-centered care to Medi-Cal members. Next slide, please. To support CalAIM implementation, there are 4 work streams that make up PATH that provide targeted funding and resources. These include cited for infrastructure development funding, the TA marketplace for technical assistance funding, and the justice involved capacity building to support pre-release Medi-Cal processes. But today, our primary focus will be on the Collaborative Planning and Implementation Initiative, which is more commonly referred to as CPI. CPI brings together 26 collaboratives across the state and are coordinated by our 9 facilitator groups that work directly with providers and stakeholders. Each collaborative functions at the county level and are designed to identify barriers, develop solutions, and enhance equitable access to ECM and community supports. Our facilitators are currently focused on building a sustainability infrastructure as well as scaling best practices, such as the best practices that will be highlighted today, to ensure long-term impacts of CalAIM. Next slide, please.
With that, I'm very pleased to introduce our speakers, Dora Barilla from HC2 Strategies and Jaron Gaither from the First 5 Center for Children's Policy. They'll be sharing best practices on how their organizations are aligning with CalAIM's enhanced care management and community supports. So Dora, the floor is yours.
Wonderful. Thank you so much, Elise, and good morning, everyone. It's really a pleasure to be here. If we'll go to the next slide, you'll see that's Jaron and I. And so I am Dora Barilla, one of 9 of the facilitators that facilitate the CPIs across California. And we partnered with First 5. So Jaron and Alexandra have been amazing partners in terms of really learning together. So I'm speaking on behalf of all of the 9 facilitators. We've all were involved in this. So thank you for having us here today. If you go to the next slide, our agenda is really looking at, one of the things that we wanted to do was really learn from each other. So with both First 5 Center for Children's Policy and all the CPI facilitators really felt it was important to build on the infrastructure that First 5 has built over the past 25 years and really look at how they integrate into the children and youth ecosystem so that we could really begin to align some of the great work that has already been developed. We're also going to share some of the best practices of the First 5s around the state that have already been aligning with ECM and community supports. And then we'll finish up with talking about some opportunities for systems integration. So I am going to turn it over to Jaron to get us started.
Thank you, Dora. Starting with opportunities for systems integration, there's really never been a more opportune time for childhood serving providers to take part in Medi-Cal. We're seeing an increased focus on early childhood and Medi-Cal transformation, whether it's through the bold goals that are outlined in DHS's comprehensive quality strategy, or the increased oversight and new responsibilities for managed care plans around preventative care and children's care measures. Additionally, the state's Medi-Cal transformation has brought with it new benefits like enhanced care management and community supports that really support a community workforce and an increased focus on preventative care and the social determinants of health for Medi-Cal members across the state. Another important opportunity for systems integration are the new memorandums of understanding or MOUs that managed care plans are required to have with local partners, including with First 5s. And these MOUs are a really great opportunity to kind of help codify relationships between managed care plans and community providers, again, like First 5s, who have not traditionally been part of the Medi-Cal delivery system. So, with all that, these new initiatives and opportunities really underscore the important role that community providers play in supporting the health and well-being of the early childhood population across the state. Next slide, please. So why First 5s and what role do they play in this new integrated system of care that we've seen through this Medi-Cal transformation? Well, for some background context, First 5s were created 25 years ago with the passage of Proposition 10. Prop 10 levies a tax on tobacco products to provide funding for early childhood development programs. Across the state, there are 58 First 5s, one in every county. And they're really, focused on supporting an ecosystem for birth equity and the healthy development of children and their families by championing home visiting programs and supporting developmental screening and care coordination programs such as Help Me Grow, amongst many other programs that they fund and deliver. In recent years, First Fives have seen Prop 10 revenue decline, which has threatened the sustainability of the programs they help deliver and fund. And as a result, many have shifted to searching for alternative funding sources to sustain their key investments. Through the Medi-Cal transformation that's happening, Medi-Cal has emerged as one avenue for First Fives to sustain these key investments that really closely align with the state's new preventative care and early childhood goals. Next slide.
All right. Well, thank you, Jaren. And so building on that, as CPI facilitators, we really found that as we were working in our collaboratives and trying to address the populations of focus for children and youth, that it really made sense to begin to partner with First Five. And as we identified, there are 58 First Five commissions around the state. So it didn't make sense for us to do this all in a silo or independently. So all of the facilitators really came together with Jaren and it identified the opportunity to really look at how can we build on that 25 years of history, that local trusted relationship. There are 58 children and family commissions that have trusted partners serving on their commissions. So they have county government, education, community-based organizations, and early child development education specialists. So they already had, in a sense, this niche and these trusted partners. So we just felt it was really important to build upon those existing relationships and how can we begin to look at how we don't create an ecosystem in a silo, but really where is there where can we complement ECM and community supports with some of the existing services, and how can we partner with some of the relationships with some of the organizations that are already at play, really ensuring that in an environment where we need to really be mindful of our resources and making sure that we're being effective and blending and braiding wherever possible to ensure that the sustainability of the existing organizations is there and that we build upon that. So I think this partnership really made a lot of sense. And really, how can we collectively start looking at advocating for some policy solutions that are impacting our children, that we can do that together? So really beginning to think about how are we integrating, how are we looking at innovation, and how are we really thinking about this as a systems change rather than a siloed initiative? And so that was really important in terms of our relationship and building and working with the First Fives. So we'll go to the next slide. I'll turn it back to Jaren.
Yeah, we can advance one more slide. Great, thank you. So with everything happening in Medi-Cal transformation, and again, First Fives kind of being non-traditional healthcare providers, at the First Fives Center, we kind of took a step back and wanted to really assess what role do First Fives play in Medi-Cal with these new benefits. So in 2023, the First Five Center for Children's Policy formally launched a learning collaborative called the First Five Medi-Cal Learning Community, or MCLC. And so that collaborative ran from October of 2023, and we wrapped up in the summer of this year, but are still kind of continuing to support our First Fives with, providing TA and implementation support for these new Medi-Cal benefits. And so as part of this Medi-Cal learning community, we really had 4 goals. One was to support First Fives in understanding the alignment between these new Medi-Cal benefits. As I mentioned previously, First Fives have championed home visiting within the state. They support a number of different health education and care coordination models across the state. And so what is the alignment between enhanced care management and community supports and even the community health worker benefit? Another goal was to develop partnerships with managed care plans. Going back to the MOU, that's one avenue that First Fives can take to develop, really meaningful partnerships with their managed care plans to support the children and youth within their respective communities. Third was to support peer learning. There's 58 First Fives across the state, and if If you know one first five, you know one first five. And so we really wanted to uplift the really important work that was happening across the state and share it with our network so that they can learn from each other and kind of take those best practices and implement them in their local communities. And then lastly, again, was providing technical assistance to move First Fives closer to implementation. And through that last goal, that's really how we got connected with the CPI table and Dora, and how we've created this really meaningful partnership to kind of really focus on children and youth implementation in ECM, community supports, and CHW. Next slide, please. So, we've had some fairly robust outcomes as part of our Medi-Cal learning community. To date, 7 First Fives are contracted to deliver CHW or ECM services. We've had 14 First Fives who've received IPP funding from their local managed care plan to support infrastructure building to become a Medi-Cal provider. Additionally, First Fives have meaningfully engaged with Path Cited and the TA Marketplace, as well as in those CPI roundtables. And then, our First Five community across the state has grown kind of organic partnerships with DHCS. And, we have a really strong partnership with our partners at the state to kind of uplift challenges that our members are facing, so that we can kind of streamline some of the implementation challenges that, these children and youth providers are facing. Next slide, please. So now I'll kind of get into some of the best practices from 2 First Fives across the state. So First Five YOLO, if you're not familiar, we're with Yolo County. It's kind of in the middle of the state, just maybe 20 minutes away from Sacramento. And so First Five YOLO is contracted with Partnership Health Plan to deliver community health worker services and the enhanced care management benefit for their Welcome Baby program. Welcome Baby is a maternal and child health equity home visiting program where families receive physical health assessments, lactation consultation, mental health screenings, parenting and health literacy information, and connections to a whole host of community resources. So Welcome Baby connects families to their medical homes and has improved well child visit rates for newborns and postpartum visit rates for birthing individuals in Yolo County. It does this by establishing a system of coordinated care across 9 local medical systems. And First Five YOLO has really utilized all the available TA resources that have been a part of CalAIM to kind of support their journey to becoming a Medi-Cal provider. As I mentioned before, they're one of the 14 First Fives that has accessed IPP funding and Path Cited funding to build their organizational capacity to bill for Medi-Cal. This includes hiring a part-time staff member to handle Medi-Cal billing. They've also leveraged TA from the TA Marketplace to get support in becoming HIPAA compliant and ensuring their data systems were set up to handle Medi-Cal billing. They're also a really important part of their local CPI table, and are one of those First Fives that are sharing their local best practices with other First Fives and also other members of those CPI tables to really support implementation of these benefits within their county and within their regional CPI table. Next slide, please. The other First Five I want to highlight is First Five Marin. So First Five Marin is also contracted with Partnership Health Plan for the ECM benefit, and they use the ECM benefit to support their local Help Me Grow program. Help Me Grow is a system of care that connects parents, caregivers, and providers with information and resources about early childhood development. It uses a centralized access point to match families with community-based services by overcoming barriers and providing ongoing support through warm handoffs. First Five Marin has accessed Path-cited IGT funding, which is intergovernmental transfer funding to build their organizational capacity to bill for Medi-Cal. They've also received an IPP grant from Partnership Health Plan to support workforce training in Marin County, which is focused on training providers in the county who support the prenatal to 5 population. Next slide, please. And I'll pass it back to Dora.
Thank you, Sharon. As you can see, a lot of great opportunities within First Five that Jaron and Alexandra had really helped advocate and move forward. And so what we did was we wanted to learn together. And so we partnered with First Five and the Medi-Cal learning community. But what we did is, as I mentioned, we pulled in all of the CPI facilitators. So we started meeting on a monthly basis so that we could learn together on what was really working and really where were those opportunities. And we sat together nearly monthly so that we could listen intently to what was going on, what was happening, what were the needs, what was what was happening currently, and where were the gaps. And then we really began to have a dialogue and learn together so that we could build those relationships and support the bridges and create, just as Jaren mentioned, really start to begin to create those bridges. And where are those prototypes and those possibilities so that we can outline, what works, and then evolve and strengthen that ecosystem. So we were excited to do that together and really, identify where those gaps were and to begin to strengthen them. So if you go to the next slide, one of the few of the things that we worked on over the year was really helping support where the TA for First Five, were available. And the Camden Coalition had really done some amazing work and helped support First Fives. And so Camden Coalition was a part of the learning community, really sharing what they had learned and where the gaps were, and really, beginning to share that within our CPIs, as well as presenting at the First Five Medi-Cal learning community so that we could have a lot of cross-learning and really begin to say, where could the CPI facilitators begin to advocate for what's needed and to strengthen that partnership. Another thing that we worked on was creating an inventory of First Five engagement across the entire state. So whether it was, that they received Pass Cited, like Jaren mentioned, or they were accessing the TA marketplace, or if they were just sitting at the CPI table, so that we have that inventory so that people could really see how are First Fives engaging, so that we could share that knowledge and learn faster and help support other First Fives that perhaps weren't at the table but had an interest and didn't know what their role was. And then we really began to target our outreach and support, county by county, and to see who was ready to engage and to give them some pathways and opportunities, because we really felt that systems integration, bridging the First Five investments with, the CalAIM, ECM, Enhanced Care Management, and Community Supports, as well as the community health worker benefits, and really helping to see how that all works together so that, again, we weren't working in isolation. So it was a great opportunity to begin to make that visible and to be able to share that across the state. Go to the next slide. And
Yeah, so just looking at some of the best practices with First Five engagements. So as Dora mentioned, we've seen increased engagement and participation with First Fives across the CPI tables, as they're hearing more about how other First Fives in neighboring counties and parts of the state have been engaged in those tables. And so I'm not going to read through everything, but just know that I think I don't have the exact numbers, but I know at least 70% of our First Fives are engaged in these CPI roundtables. And as kind of these as funding for PATH and the CPI roundtables are moving towards sunsetting at the end of 2026, it's really important now more than ever that we continue supporting, TA and implementation support for, not only First Fives, but other community-based organizations who are looking to leverage these new Medi-Cal benefits in support of children and families across the state. Next slide, please. One more. And I'll pass back to you, Dora.
wonderful. And so we're clearly seeing that one of the opportunities as we're thinking about systems integration is helping those First Fives currently with support from the TA marketplace, really knowing that there is an updated criteria for organizations that really haven't accessed the TA marketplace before. How can we help those First Fives that haven't accessed the TA marketplace and really get them in? So really been a targeted focus to say, there's resources on the table. Let's make sure that we get those that haven't, that might have been in the background and might be ready now, to get them in the forefront. So really helping to create that new opportunity to help First Five get help with that contracting. And so we really see this as a key opportunity to support First Fives with the TA marketplace in 2026. Next slide.
And another opportunity, and I know, PATH and Medi-Cal transformation is really focused on enhanced care management and community supports, but really through the Medi-Cal learning community that, we've been hosting, we really see community health worker services as being a really helpful kind of entry point into CalAIM for many of these community-based organizations that can eventually, once they start billing for CHW services, can then transition to, providing ECM. With both the community health worker services and enhanced care management benefits, there's key alignment, or there's really close alignment between those key first 5 services, again, with care coordination, health education. Additionally, with the standing recommendation for CHW services that came out earlier this year, there's a reduced administrative burden for providers to deliver services and get reimbursed and find those eligible Medi-Cal members. And again, that standing recommendation also makes it easier for Medi-Cal members who are eligible to access services. And then, lastly, again, as I mentioned, the CHW services benefit, we've seen be a real stepping stone for our first 5s to kind of prepare to bill for ECM and community supports. Next slide, please. And then another opportunity is community hubs. So, a hub is an entity that centralizes administrative functions and operational infrastructure to support, their partner organizations to bill for Medi-Cal services. And so really the main function of a hub is to facilitate connections between Medi-Cal and new types of providers. And so for first 5s, there's many first 5s across the state that don't deliver direct services, but have strong relationships with their funded partners in the community who are really trusted by the early childhood population and their families. And so, there's through a hub model or being a supervising provider, these organizations are able to provide that kind of backbone infrastructure support to smaller organizations that otherwise wouldn't be able to, get over those barriers, the really financial barriers to becoming a Medi-Cal provider. And so, by centralizing those administrative functions, hubs can really increase the capacity for smaller organizations to bill for Medi-Cal. And within First 5, there's, I would say a good portion of our members are kind of moving in that direction to becoming hubs with their funded partners.
Wonderful. Thank you, Jaren. And I just want to reiterate that many of the CPIs across the state feel that this is a great opportunity. So really supporting First 5s with thinking about that hub mentality so that they really can be that support long-term. And as Elise and Sean mentioned, one of the key focuses of the collaboratives over the next year is looking at sustainability. And so we really view this as a key sustainability model and excited to be partnering with First 5 on this. So we'll go to the next slide. And as we, finish up and we think about next steps, we're going to continue to meet as a work group with First 5, continue to partner, really begin to look at how can we activate those partnerships with First 5 in each one of the counties, really share some of those best practices and so people can say how are First 5s working, what's possible so that they can excel those, build those bridges and excel some of those strategies forward. As Jaren and I were just mentioning, that community hub is really a logical next step to expand the number of children that are receiving services, ensuring sustainability, making sure that we're not operating in silos, and continuing to build on learning together with our advocacy and our systems integration. So thank you for the opportunity to present, and I'll turn it back to you, Elise.
Great. Thank you so much, Dora and Jaren, for your presentations. Just a reminder, we will have some time for Q&A at the end of both of our presentations, so you will be able to see and speak with Dora and Jaren again in a bit. But I'm now pleased to introduce our next speakers, Hannah Duvivier from Intrepid Ascent and Chalumba Kabango from Bay Area Community Resources. They'll be presenting on activating public schools as community-based CalAIM referrers for children, youth, and families. So Hannah, I'm going to turn it over to you.
Thank you so much, Elise, and thank you PCG and DHCS for having us here today. Next slide, please. Today, I'm really excited to share about the Contra Costa CPI's Children and Youth CalAIM Awareness Campaign. Our multifaceted efforts that were launched in February of this year really focus on activating the wide array of school-based providers to make community-based referrals into ECM and community supports for the students that they see and care for every day. Next slide, please. And you can tap one more time. Thank you. So consistent with the trend across the state, Contra Costa County has lower than desired enrollment of the children and youth populations in ECM and community support services. So looking at our county data in Q1 of this year, about 1,500 children across all populations of focus were receiving ECM services. Then using county level Medi-Cal enrollee data and the conservative estimate that about 3 to 5% of all Medi-Cal enrollees are eligible for ECM, we estimate that there are a little over 5,700 children in the county across all children and youth POFs that are eligible for ECM. So this year, at the direction of our collaborative, we focused on children and youth enrollment. In December of 2024, the CPI expressed interest and desire to create dedicated outreach strategies for key populations that were not utilizing CalAIM at high rates of saturation. So after some subsequent discussions in January and February of this year, the collaborative decided to resource engagement with local school districts to really increase children's access to ECM and community supports, recognizing that the child is the gateway to the entire family unit. Intrepid has since been testing 3 strategies to engage these members of our community. Number 1, a Children and Youth CalAIM 101 for schools and other service providers to increase awareness of the programs and to increase community-based referrals. Number 2, a CalAIM overview for parents and caregivers to increase awareness and self-referrals. And then 3, a school site referral workflow and training to equip school-based staff to support referrals both for and with their families and students, anchoring on their unique experience of interacting with them every day. Next slide, please. So it's really important when considering engaging schools as a whole to remember who refers could be. It is not just the teachers and the principals that we might automatically think of. Every single touch point that a child has at school could be that touch point that catalyzes a referral. So we're talking about coaches, social workers, after school program staff, foster youth liaisons, navigators. We're really talking about the entire school ecosystem as stakeholders that could move children and youth through these referrals. Next slide, please. So since February, we've done 5 CalAIM overview sessions for vastly different audiences. We were able to use basically the same presentation because it really anchored on that core message that these different groups, as people that work with children in various capacities, could play a key role in getting them the case management and the community services that they need and are eligible for. So to initially convene stakeholders, we did cold outreach to 284 principals and 70 office administrators across the 18 school districts that are in Contra Costa County. And then after our first session, the outreach actually expanded to include 17 community schools coordinators and counselors and a handful of district school nurses. So that first webinar had 23 participants from a variety of roles. The principals really that we did outreach to really made sure that the right stakeholders in their schools, the coordinators, the counselors, the navigators, were in attendance at those sessions. So we used that initial outreach and presentation to snowball participation, really creating all of those other opportunities that we've done since. We have presented to 42 attendees of the Contra Costa Comprehensive Prevention Planning Team, 12 parents and families at an elementary school parent coffee chat, 22 school nurses in Mount Diablo Unified School District, and almost 40 foster youth McKinney-Vento liaisons at the County Office of Education. And I want to mention that for that parent coffee chat session, the presentation was also translated into Spanish, and I presented alongside a local ECM provider and an MTM provider to really support any potential on-site self-referrals that may have come from that presentation. Next slide, please. So the pre and post engagement surveys that we conducted show that these sessions really worked. There's been a positive impact for both county and non-county audiences around growth in knowledge and understanding of the programs, and the confidence in being able to bring this information to students and families and help them act on it by supporting that referral process. So the graphs here show positive impact in February for non-county service providers, in April for county service providers, and then in May for school site anchored service providers. So we can see just this growth in knowledge across all these different provider types. As has been the case in this process, our community of stakeholders wants to grow impact beyond that first step of awareness and confidence. From that initial engagement, we were able to meet our friends at Bay Area Community Resources, who see this as an opportunity to implement a CalAIM school site referral workflow pilot at a middle school in Richmond this school year. Next slide, please. So with that, I am so honored to pass the mic to Chilumba, my partner in crime in this workflow, to share a bit about his experience engaging in this work. Chilumba.
Good morning, everyone. Thanks for having us here. I'm gonna give you a little bit of background of how I got here. So back in the first week of February, I got an email about CalAIM, and by the end of the same month, I joined a webinar to learn more. The following week in early March, I reached out to Hannah to start a conversation. I introduced myself and my role at Lavanya DeJohn Middle School and explained our unique position. We already have a full-time Contra Costa family navigator on our team. So I asked her for how our school's care team and our county navigator could start generating the right referrals for CalAIM, and whether she'd help me brainstorm an ideal workflow for the site-based referrals. And so by mid-April, that conversation expanded to include Sandra, our Contra Costa family navigator, and Joyce, our community schools manager. And what started with an email became a working collaboration. So thinking a little bit about what we've been going through, what's been helpful, what's been sticky. What has been helpful is exactly that, partnerships, reaching out, building trust, and starting the workflow conversations early. What's been hard is just capacity, right? Principals and teachers are already stretched thin. Even when services like CalAIM exist, the infrastructure to connect families isn't always strong enough. And where I've been stuck is right there, right? Knowing programs are available, but not always having the right team in place at the school site to make sure that the families actually get connected to the services that are available. And so thinking about the big picture, our school is a proud recipient of the California Community Schools Partnership Grant. It's a grant program dedicated to transforming schools and the way we do things in California public school. We do that by creating strategic and sustainable partnerships like this cross-sector collaboration focused on CalAIM, Intrepid Ascent, and Contra Costa County. At their very best, community schools are hubs that integrate academics, health, and social services. They're built on authentic engagement with families and collaborative leadership. The CalAIM children and youth populations of focus fit the demographics of the community that I serve in. That makes our site uniquely positioned to generate referrals and maybe even serve as a case study or a model site that can rapidly be replicated when the right conditions are in place. So my recommendations, what we're really talking about is building capacity. By pairing navigators with coordinators, we strengthen an implementation on the ground. That protects instruction and ensures that when programs like CalAIM are available, families actually get their services that they deserve. And in closing, for my part, you're all in the position to make this real. When we put the right people in the right positions and in the right place, we don't just run programs, we change outcomes for families. So that's been my story arc in this work. and learning how to connect the dots, build partnerships, and advocate for the capacity we need to truly deliver on the promises of community schools. Thanks. I'll pass it back to you, Hannah.
Thank you so much, Chilumba. Excellent job. Next slide, please. So as we close out, I want to be clear about the success of this 6-month campaign. 284 schools were part of that initial outreach, and we actually found their information on the Public Schools Directory that's on the Contra Costa County Office of Education website, and by going to individual school websites as well. And we sent them a series of emails to fill seats in that first February presentation that Chilumba joined. At this point, more than 100 people have participated across our 5 presentations, with an average growth in knowledge and confidence by 38% across 3 of those presentations. We know that this is already supporting school-based referrals. Our partners at Bay Area Community Resources and in Mount Diablo Unified School District have been reporting that they've been doing community-based referrals since the start of the school year. But there's still, of course, an opportunity to optimize those referrals and really try to capture the volume that's generated by schools and by districts. And that's why we're so excited to launch the work that we're doing with Chilumba and his team. With our continued commitment of measuring impact, should impact be demonstrated, we really hope to scale the practice to other schools and with all of your help, maybe to other counties as well. So as we hopefully instigate this work in other communities, we want to make sure that you're also equipped with the key considerations that we've learned and encountered along the way. Number 1, the school year in California typically begins in late August or early September, and it ends in May or June. This is really important to keep in mind as we're trying to deepen our connection with schools and implement these types of workflows. So what does this mean? It means start to do your outreach now because school is in session. Number 2, with all patients, but perhaps most importantly and most especially our kiddos, it's so important to remember that continuity of care matters. To Chilumba's point, we're trying to be systems that are worthy of trust for these students and their families. So from the start, we encourage any CalAIM providers that are working with kiddos to consider the necessary levels of acuity and step up, step down processes between ECM and CHW providers so that kids always have access or always have the option to access case management services that are right-sized for them. At the end of the day, we really want to help maintain access to supports even as the need for these services decreases in acuity. Number 3, awareness campaigns like this are replicable should the right resources be created. We at Intrepid have tested the impact and started to codify the tools and resources that drove our success of this campaign. That QR code on the screen will get you access to our free school-based children and youth outreach toolkit, and you'll see everything there from the template outreach emails that we sent to our CalAIM 101 overview for parents and providers in English and Spanish, to sample resources that we've kept on hand to support the referrers and the families in these engagements. And number 4, the CalAIM capacity building funding is largely limited to those that are actively providing services. School-based clinics and resource teams are not necessarily likely or even the best suited to be ECM or community supports providers. So really supporting awareness and engagement within the school systems is going to require a level of creative resourcing that lives outside of the current CalAIM technical assistance and capacity building resources. Or it's going to require a reconfiguration of who is actually eligible for those TA resources. Next slide, please. This campaign generated valuable tools that functioned as entry points for deeper levels of community engagement with our public schools, who already care so deeply and so passionately for many of the children that are eligible for these services. We hope that the resources we shared help fuel work in your communities to activate your local schools as the really good partners that they are in caring for our kids and their families. But this is really about more than just that. At this time next year, we have a couple of hopes for us as a collective care ecosystem. We hope that we see as many children that are eligible for these services be recipients of these services, especially our youth managing homelessness, our youth in foster care, our youth reentering community. We hope that more schools are engaged and empowered to support their students in accessing these Medi-Cal services. We hope that more students are enrolled in these services, so school navigators and coaches and teachers have the confidence that the kids in front of them are fed, are housed, and are supported with their medical and non-medical needs. And we really hope to see more Chilumbas and more navigators like Sandra and more school nurses like Rosie in these conversations about Medi-Cal services and healthcare, because really, who better to guide us in doing right for our community's children than those school-based providers that we trust them with every day. I want to invite Chilumba if you have any future aspirations that you want to share from your perspective.
Thanks, Hannah. With the right strategy and the right resource allocation, we can allow school sites to keep the main thing, which is education. And folks like me and Sandra can support the students and their homes, right? To be able to get access to the resources that are available. And these types of partnerships will allow students and families within the community to be able to focus on academic achievement, and it'll allow the state to use strategies like community school funding to continue that there's partnerships between education and healthcare. And I just think we have a good opportunity here. And if we continue to work in this collaborative way, we'll be able to just change outcomes for families, which is really the whole point of the California Community Schools funding in the first place.
Thanks, Chilumba. So lastly, just a few simple action items to consider. Use the email templates in that toolkit to initiate a relationship with your local school administrators. Consider adapting your information for different audience types or even in different threshold languages in your county or your region. And really lean into partnerships and relationships by utilizing existing work groups and collaborative networks to sustain that engagement. If there's anything else that we can do to help you take next steps that feel right for you and your community, please reach out. If I am able to, I will drop my email address in the chat for anyone who may want it. But thank you so much for having us, and I will pass it back to Elise.
Thank you, Hannah. So just really want to thank Dora, Jaron, Hannah, and Chilumba for all of their insights and presentations, and also everyone who has joined us today. We really hope you're leaving with some ideas you can apply in your local communities. We do have a few minutes to address some of the questions that were submitted during the webinar. So we're going to start with a question for the First Fives presentation. So Dora and Jaron, this one is for you. Are any First Fives working with other hubs like CHW hubs or the KP network lead entities, hubs themselves whom Kaiser will only contract with, like Full Circle Health Network? And how might we limit the risk of too many hubs that are competing?
Do you want to take that one, Darren? Or
Yeah, I can
Okay.
take that. That's a great question. So as far as First Fives working with other hubs, yes. So we've had some conversations with Full Circle Health Network, who is one of the network lead entities for Kaiser, and I know that they're kind of slowly getting involved with some of the other managed care plans in different counties across the state to support some of the admin responsibilities for billing. And so we do have some First Fives who are either in the early stages of engaging with Full Circle Health Network. As far as kind of ensuring that there aren't too many hubs within a network, I think that's where having a really good relationship with your managed care plan comes in, and also having a relationship with your CPI table, so who are the players within your county, so that you can collaborate and work together to better serve children and youth, because I think that's everybody's goal. We don't want duplication of services or any confusion for this population that already has difficulty kind of receiving services that they're eligible for.
Yeah, and I'll just add to Sharon's point about the CPI tables. A lot of the CPI tables are working on asset mapping for systems of care for children and youth, and that's a great opportunity to really lean in, identify where those hubs are, avoid duplication, and make sure that we're, leveraging any existing hubs. So get engaged. Thank you.
One more question for Dora and Jaren. What might be the best way for someone to find out if their local First Five is contracted with an MCP to provide ECM, community supports, CHW, or related services? And what is the best way for someone to get in touch with First Five to collaborate?
Yeah, so I think the immediate next step would be to find your local First Five and contact that executive director. I know we're working on in partnership with the CPI table, making some of the resources that we've collaborated on external to just the general child provider network. And so as part of those resources, we'll have that data on which First Fives are contracted, what services they're providing, and things of that nature. Hopefully that'll be coming out at the end of next month. But I think immediately, if you contact your local First Five executive director, they can support you with that.
And what is the best way to find the contact information for the local First Five executive director?
Yeah, I would just, if it's, for example, if you're in Yolo County, just Google First Five Yolo. Every First Five has a website that has contact information to that First Five. So that's what I would do.
Great, thank you. So question for Hannah and Chalumba. Can you speak to any data on increased referral rates or other proxies for success by partnering navigators with school counselors? How do you know this is working well?
So excitingly, we just started this pilot this month. Chilumba and I are actually going to meet next month to talk about any data, any referrals that they've seen come in, how that's going with the navigator in kind of doing that warm handoff in that education piece. Chilumba, if you've actually seen any of that data, is there anything you want to share?
Well, the idea of the county navigator, what that is really it brings in the county resources into the school site. So that person is able to build trust with the community members. And our county navigator is funded by Measure X funds up here in Contra Costa. And what her role does is increase the capacity at the school site, because instead of sending one of my eighth graders to a clinic on his own, we were able to see a need, we're able to address his need, and then take him directly to the services within the county via our county navigator, because our county navigator has access to school information. They can call home, get permissions, take students to and from appointments. And that has allowed us to just go from setting people up to not only setting them up for success, but following through all in the school day. So it's not something a family would have to do on the weekend or after school hours. I send my student to school, my student gets what they need, I pick them up at dismissal. So that role of the navigator really helps drive the work. And when we meet later this month, we'll be able to just go through the data that we have with all of our care team referrals. So, each school site has a care team, and I don't know if everybody knows what the acronym is, but essentially, we're a team that coordinates access, resources, and equity for students that have needs, right? Anyone on the school site can make a referral. And then from those general referrals, we kind of triage and see what the actual need is or what the barrier is. And then having a navigator, and in combination with CalAIM and their community resources and ECM, it'll allow us to really pinpoint where and who can get the services to the family. So it's really been excellent. And everywhere I go, I'm just hoping that community school coordinators can be partnered with county navigators so those resources are available to the families through the school site where the trust is built. I hope
Yeah,
that
and
answers the question.
And I just want to add, that's the really cool part of this, is that they're already doing internal referrals at their school site for students that need academic and behavioral support, that we're just adding now new resources that they can do referrals for. So it really was kind of like a seamless addition to the process that they're already doing at Dijon.
Great. Thank you, Chalumba and Hannah. Generally speaking, what are the eligibility criteria that people should be considering when thinking about potential children that could benefit from services?
Yeah, I'll take that one. So I think, if you look across the populations of focus that are eligible for enhanced care management, I mean, it really is very broad. So it's children that are experiencing homelessness, children and youth that, are medically complex and at high risk for hospitalization or ED utilization, children with serious mental health and substance use disorders, children transitioning from incarceration, those that have been involved in the foster care, as well as, the birth equity traditional that we've thought about. So it really is a broad spectrum of eligibility across multiple populations of focus for our children.
Thanks so much, Dora. I know that some questions came through about how to learn more about how to get connected with Medi-Cal or First Five to support understanding the whole process to continue offering these services for free. So we definitely recommend connecting with your regional CPI. They're designed to help individual organizations work through some of these questions and have resources and supports that can help navigate. So just wanted to put a plug in there for engagement in CPI, which will be running throughout 2026. So still plenty of opportunity to engage with the CPIs. I think we're going to go ahead and close out our Q&A for now. We really appreciate everyone's engagement, and any remaining questions will be compiled into a Q&A document and posted along with the slides and the webinar recording on the CPI website after today's session. I'm going to go ahead and turn it over to Sean to close out today's webinar.
Elise, and thank you everyone for your time and attention today to these best practices. If you haven't already, we hope that you will join a CPI collaborative in your region by clicking the registration link that will be dropped in the chat. Additionally, as many of you are starting to see now, we have just launched our evaluation poll. So we kindly ask that you take a few moments to complete this poll so that we can continue to strengthen our biannual webinars for you. Next slide, please. Please stay tuned for announcements of the next CPI Best Practices webinar, which will be taking place in the spring of 2026. Topic, date, and time to be determined, but stay tuned. Next slide, please. On the screen here, you can see some of the evaluation poll questions that are being asked of you if you'd like a view of that. And we appreciate all of your feedback. Next slide, please. And while you all are completing that evaluation poll, we just wanted to say one last thank you on behalf of DHCS and the PCG CPI team and our presenters. We greatly appreciate your participation in today's webinar and hope to see you again in the spring. So thank